Welcome to Lessons in Leadership, Steve Adubato, with my colleague Mary Gambit. Mary, we're talking about physician-nurse communication and its connection to leadership, and we have two expert leaders in the healthcare world, our longtime colleagues and partners at Hackensack Meridian Health. Please introduce them, Mary.
I would be very happy to do so. We have Ramonita Jimenez, Vice President and Chief Nursing Officer at Hackensack University Medical Center. And also we have Michael Stifelman, Professor and Chair of Urology for Hackensack Meridian School of Medicine. Dr. Stifelman and Ramonita, thank you so much for joining us today.
And Ramonita, you are a doctor of nursing practice, are you not?
That's true.
Yes, that's correct.
Yes, I am a doctor of philosophy. That's where my PhD. When people often, Mike, you and I have known each other for years. When people refer to me as Dr. Adubato, I do not correct them because they're confused. And then they'll ask me a medical question. I'm like, not that kind of doctor. All good. Hey, Mike, tee this up, Mike. Mike and I have been working together for many years. Mike has been part of the HMH, Hackensack Meridian Health Physician Leadership Academy. We've done one-on-one coaching with him. And he and I talk about leadership and communication a lot. Mike, put in context the importance of physician-nurse communication, particularly under stressful conditions, and what the heck that has to do with leadership. Please, doctor.
We can't do anything as physicians without nurses, okay? We could be the best surgeon, we can have the best ideas, we can have the most creative, innovative thinking, but without the nursing team, we are nothing. We are nowhere. So in order to be able to communicate well with your team and get them to understand what you're trying to do and what we're all trying to do is crucial to success of any program, any hospital, any partnership. So I would say every single day, multiple times a day, we are communicating back and forth with nurses. And that could be something as simple as, doctor, the blood count is wrong. What do you want to do? Or it could be something as significant as, we have a problem with this patient and we need some input. Or it could be even more global, where we have what's called a throughput issue, or we can't get patients off the floor. We have people stuck in the PACU and the whole ship is halting to a grind. So every day, every moment, communicating with nurses is probably one of the most critical things we do as physicians, and often, unfortunately, overlooked.
It's so well said. And Ramonita, let me ask you this. You and I have talked about this issue as well. And I imagine in some people's minds, the surgeon, the doctor is the whatever, and meaning that's the only leader, that's the captain of the ship. Okay, and in certain cases that may be true. But nurses are extraordinary leaders as well. Talk about the role of nursing and nursing leadership as it relates to what your colleague was talking about.
So as Dr. Stifelman mentioned, nurse-physician communication is critical. In order for us to be able to carry out a plan of care for a patient, the nurse and the physician have to be communicating, right? In a leadership role, it's important for me to communicate with my physician colleagues as well, to ensure that, nursing practice is what it needs to be and how they can support nursing to be able to provide the care that the patients are expecting and deserve.
Yeah, it does take an incredibly collaborative team to do that. Mary, please.
Yeah, definitely. And Mike, please talk a little bit more about, in a stressful environment, all of this sounds really great on paper. It sounds good in theory, sounds good in the classroom. All of this I'm buying in, right? We need our physician leaders and our nurses to communicate. But in that stress-filled moment, what tips, tools do you give to your physicians and your nurses to play well together in the sandbox, right? Because I could see it also being like butting heads a little bit. So what advice do you have? Because it will also apply to other businesses as well, to communicating in those fast-paced, high-stress situations.
So, as a surgeon, there's and someone that does a lot of minimally invasive surgery, when something starts to go sideways and all of a sudden we need to open and we need to get blood in the room and we need to get other physicians in the room, things are going sideways, things are going quickly, and communication is so important. A couple of things that I always try to do. Number one, take a deep breath. Number two, be calm. Everybody is looking at the surgeon at that point to stay calm. And you are going to set the tone. You're going to set the temperature of the room. You have to keep that. Number two, clear and succinct communication. There's a term a good friend of mine once used, keep it in the goalpost. I don't know if you ever heard of that before, but you gotta keep it in the goalpost.
Oh, that was such a surprise.
Right. All right. Yeah. Okay. Go ahead, Mike.
But Mike, seriously, explain what that means, because that is so helpful.
Because you've got to step back and think for a second. What do you want to say? What do you want to ask for? And in what order? And, that's so, and because then people have direction on what they need to do. And I don't want to get upset, but like if someone's hemorrhaging or we have a catastrophic event happening, I need blood. What does that mean? I need blood. I need a rapid transfusion protocol now. I need a second anesthesiologist in the room. We need, another line place. We need a swan. I need you to call vascular. I need to call general surgery. And you got to put it in a very clear, succinct way and not make it there's no ambiguity here. Number two, if you see someone on your team starting to lose it a little bit or getting anxious, or you got to recognize and look at the room around you and go to that person and say, no, we got this. We totally got this. I just need you to go and get that. All right. And if they're struggling at helping, you sort of move them out of the way nicely and you get someone else in who's maybe more experienced or more senior or more calm to do it. So I think three things: clear communication, calm, take a deep breath, and take a temperature of the room and look who's in the room and see who is really on board and following what's going on and who looks like they're just a deer in headlights, and redirect them so they become more productive. That would be the three things I would take away.
And Mike is mocking my coaching from years back when I said we need to communicate within the goalpost, which is as a euphemism for being disciplined and focused. Mike, that's worked over the years, no?
So first of all, in no way was this mocking.
I didn't think it was mocking either, Mike.
If anything, it was meant to be a compliment to you.
I'll
And the
take
fact
it.
that I remember, to keep in the goalpost, and that's something that stuck with me.
Are you? By the
It's a
way,
good thing.
I know that Bob Garrett, the CEO of HMH, is a huge Giants fan. HMH is the official healthcare organization. Ramonita, are you impressed that I had this prop right here?
I'm very impressed that you have that prop
I
right.
got a baseball, I got a basketball, and I'm sorry, I got all these. And Ramonita, to go back to what Dr. Stifelman said, the keeping calm part. For nurse leaders, and we're going to be doing some nurse leadership coaching as well at HMH in the next few months. Dr. Stifelman talked about this even keeled, and he's so right about that. And there are times I've done that and times I haven't, and trust me, there's a difference. How the heck do you coach and train people in the nursing profession to be that, or is that who you are or who you're not?
I believe that you can train people to be calm, but there are some personalities that I believe are a little more, aggressive. But I would say that the communication is critical, and remaining calm under pressure is absolutely essential. The reason being is we're making quick decisions about patients. So one of the things that I have found to be very helpful is if I see a colleague that is struggling and we need to make quick decisions, I'll step in and lend a hand and offer some suggestions, or literally say, hey, let's do this next, because you're in an emergency situation, right? So you have to act quickly. And if it's not an emergency, you still can step in and say, how can I help you? I think that's important. So people feel, hey, we're part of the team, we're part of the bigger team, and we're here to help each other. But the communication is definitely important.
Mary, let's clarify a couple of things. There are two initiatives that our firm, Stand and Deliver, are very involved in at HMH. One is the HMH Physician Leadership Academy. I think it's 5 years, Mary, that we've been doing
I think we're in our 5th year now.
Fifth year. And also the Executive Leadership Development Program, the ELDP. It's run by the talent development folks, and they are absolutely terrific at HMH. But along those lines, real quick, Mike, on this, got about a minute left. For top physicians and clinicians who you're around, Mike, who say, I don't need to learn leadership, I know it already. What's your message to them?
You don't know what you don't know, which is you don't know it already. And to be very transparent, when I started the Physician Leadership Academy 5 years ago, and I sat in Edison, New Jersey for the first time eating bad, chicken.
Hold on, this is pre-COVID when we used to be in person. Go ahead, Mike.
I remember walking in there and looking around and saying, what am I doing here? I don't need this. I'm a chair of a department. I'm very successful. I'm 50 years old. I don't need this. And I will tell you, and I walked out of there 2 hours later, I said, and I called up the person that recruited me. I said, that was the best thing you ever did. I love it. I get so much.
Who was the seminar leader?
Oh,
You were the seminar leader.
Okay, I'm sorry.
Yes.
oh, Mike, you fell right into that
I
one.
just wanted to see Mary's reaction. Go ahead, finish your point, Mike.
But I guess the point is there's always an opportunity for us to learn from each other. And to me, one of the magic sauce, the special sauce behind these sort of opportunities are really threefold. Number one, you get out of what you're doing every day. You're either you go to a remote location or you get on Zoom,
right,
at an evening hour, so you get away from your normal.
You got to get away from your day to day.
Number two is you get to listen to other people's perspectives, okay? Not your own. You're not your own voice in your head all the time. And number three, by listening and being in an environment where you can hear others' perspectives, you start to realize, wait a second, I could have handled that differently. I have an opportunity to do that better. I'm going to try this tool or this approach another way. And those are the things I love about Leadership Academy. I love the breakout sessions. I love the exercises. I love watching people go through and thinking to myself, wow, I like the way they did. I never even thought of that. And so
you learn from it. But Ramonita, before I let you go, I'm curious about this. Mary and I were talking about this when we were talking about the nurse leadership work that we're going to be doing in 2024. And I thought, Mary and I thought about this, and Mary's much more sensitive and aware than I am to this. I'm like, yeah, well, we can help the nurses become better leaders. Mary's like, do you know what they're facing right now? Do you have any idea what the burnout is like? There's a nurse shortage, nursing shortage. So Ramonita, here's the question. How the heck do we get your colleagues or colleagues anywhere in the nursing community anywhere to say, I need to work on being a better leader when they're trying to keep their head above water and they're drinking out of a fire hose?
Yeah, that's reality. However, I think it's critical for leaders to invest in themselves and for leaders to be able to set aside the time, just like Dr. Stifelman mentioned, setting aside the time to learn and to further your learning in terms of techniques or strategies that you can use in leadership to help you. So I can tell you that to me it's critical. So I would say to that leader, you have to set this time apart because you have to invest in yourself. If you do that, you can better engage your workforce, which is important at this time, right? Yeah.
More important than ever. Mary, as we let Mike and Ramonita go, you and I talk about this all the time. When leaders say, or people we work with say, I know what I need to know, that's when you know you're in trouble.
Exactly. I couldn't have said it better myself.
Yeah, you stop learning, you're going backwards. Mike, Ramonita, cannot thank you enough, and to your colleagues at Hackensack Meridian Health, it's been an honor to collaborate with you, work with you, and frankly, as Mike said, learn from you as well, and cannot thank the physicians, the nurses, and everyone on the front lines who were heroes for a short period of time in the mind of too many during COVID. And then after, no, they're still doing it every day. Thanks, Mike. Thanks, Ramonita. This is Lessons in Leadership. Stay with us. We'll be right back. This edition of Lessons in Leadership is made possible by the Buccino Leadership Institute at Seton Hall University, Prager Metis, Valley Bank, the International Union of Operating Engineers, Local 825, the North Ward Center, the New Jersey Sharing Network, Delta Dental of New Jersey, the Helix, Fedway Associates, Inc., the Port Authority of New York and New Jersey, Veolia, Resourcing the World, Choose New Jersey, and Seton Hall University, showing the world what great minds can do since 1856.
This is Mary Gamba. If you want more leadership tips and tools, log on to stand-deliver.com. That's stand-deliver.com.
Promotional support for this edition of Lessons in Leadership with me, Steve Adubato, and my colleague Mary Gamba has been provided by NJ.com, NJBIA and New Jersey Business Magazine, CIANJ and Commerce Magazine, and the Meadowlands Chamber and Meadowlands Media.
Introducing the Helix NJ, the Health and Life Science Exchange, a new innovation district located at the heart of the Northeast Corridor, providing industries, universities, and entrepreneurs the critical ecosystem needed to turn great ideas into breakthrough realities. The Helix NJ, where ideas come to life.
Most people don't think about where their water comes from, but we do. Veolia, more than water, resourcing the world.
Mary, we're about to see an interview with Krishna Powell, the founder and CEO of HR for Your Small Biz. Why is this such an important leadership conversation?
It is so important. We talk about, as part of our special series on lessons in leadership, small business leadership. What's different? What's unique? Are there differences? And Krishna really talks about what are some of those things that are really important that will set small businesses apart, and why certain small businesses will thrive, and while others, unfortunately, need to close their doors.
Yeah. You know, people say, oh, small business, they must be small issues. You just don't have as many people to deal with them. So it's an important, compelling conversation with a terrific leader making a difference. This is our conversation about leadership, small business with Krishna Powell. Check it out. We continue our conversation about women business leaders with Krishna Powell, founder and CEO of HR for Your Small Biz. She was with us in 2018. Go back on our website. You'll see steveoutabout.org to see that previous conversation. Krishna, how you doing?
I am doing great. It's good to see you.
It's great to see you. How about this? You told our producers, and you spoke about this at the New Jersey Business and Industry 9th Annual Women Business Leaders Forum, that there were two new generations in the workforce of women. Who are we talking about?
So we're talking about Gen Z has now entered in the workforce. So those are like your 22, 23-year-olds. And then we also have the alpha generation coming in. And so those are your young people who are having who have the summer jobs.
Okay. So can we take them a piece one at a time? What would you say to those? Let's play this out for a second. We happen to have a very young, talented, I believe she's 25. Caroline, I think she's 25. She's a talented marketing professional, hardworking, diligent, with great upside leadership potential. My prejudice, I'll put out there. I'm not convinced she's the norm. Translation. My bias is that I sometimes think, and help me on this because you know it, I don't, that a disproportionate number of younger people are not willing to have the grit, put in the work, put in their time to learn and grow, and in part because of this. Am I oversimplifying it?
Well, I won't say they're not willing. A lot of times they just have not been taught. They don't know what it looks like. If you think about it, they have spent the last 2 to 3 years with the pandemic in 4 walls. They didn't have anyone grooming them. They didn't have the face-to-face conversation. They didn't have the interaction. And then we drop them off in the workplace now and say, go out there and work, be successful. They don't know what that looks like.
They don't know what they don't know?
Exactly. So it's now our responsibility to teach them. So a lot of times we think, Krishna, they should come in already knowing this. For my generation, for your generation, yes, we came in, we were groomed, we had internships, we had summer jobs. Summer jobs are scarce now. There's not even the jobs available for them like there was for me growing up here in New Jersey. And so you have these young people now, and they're in the workforce, and they're like, someone has to teach me, someone has to show me, someone has to explain to me the why. A lot of times we think that they should just do as they're told. And they're like, no, this is the generation.
Yeah, why am I doing that?
Exactly.
I screwed up out of the box. I should have asked you while we put up your website, Krishna. Describe HR for Your Small Biz. What is the business?
So HR for Your Small Biz, we are a boutique human capital consulting firm. So what that means is that I show leaders how to manage a multi-generational, multicultural workforce. What does that look like, having this diverse workforce? So it doesn't matter if you're a small business or a large business.
You could be talking about our production company right now, so go ahead.
So that's, I mean, for the first time in history, we have 5 generations in the workplace. We've never had that before. 5. And they're not holding hands and singing Kumbaya.
Why? No, we're not. You're seeing heads going, no, you're not. We're not holding hands. So should we as leaders of these organizations, businesses, should we want and try to encourage, if not force people on our team, 5 generations, to be holding hands and singing Kumbaya, or saying, that ain't going to work? Go ahead.
It's not going to work. I mean, think about it. We have family members. Some of us have children, and we don't sometimes like our own children. That's okay.
It's true.
Always hold hands and sing Kumbaya as a family. That type of conflict and challenge is expected. And so as a leader, you have to help guide your team through it and help them to understand and appreciate the strengths that each other bring to the table. This is a smart, brilliant generation. They've learned the art of working smart. They don't necessarily know how to work hard. That's for us to show them. So together, we combine their smart with our strong. There's nothing we can't do.
That is for us. Anxiety, mental health. Your business deals with and helps organizations, businesses deal with, first of all, how to help team members dealing with mental health, anxiety issues. How does a small business deal with that?
So, well, patiently. Unfortunately, what we're seeing is also with the younger generation, more mental health issues than the previous generation. So we do have to build
Why do you think?
Allow for parameters and space for them to work through if they have anxiety and stress that shows up, and help guide them through when things get difficult. They don't necessarily always have the tools to handle the stress. Think about it. You by yourself, you have 5 jobs.
I'm sorry, there's a little bit of a delay. Can I ask you this?
Mm-hmm.
Go back, before you talk about what we should be doing, I wanted to ask you, do you believe there is more anxiety and mental health issues in the workplace, or that we're more aware of it, and what's causing it?
So there is more mental health issues in the workplace. The pandemic really brought that to fruition. There were people who did have challenges, but unfortunately, when the pandemic happened, they weren't able to get those resources and support that they needed to help adjust to the solitude, to adjust to all the changes that happened. And even those who were doing well before the pandemic happened, it was a very stressful time for all of us. And so now you come back into the workplace and you still have that stress. People have had, deaths in their family and losses and et cetera. And they're still working through that. So yes, there is the levels of anxiety and stress is much more greater than it was before the pandemic.
Before I let you go, I've asked every leader who's ever come on this question: where does your grit, G-R-I-T, come from? Your grit.
My grit comes from my community and those who have come before me. I salute those who have come before me. I have those such as Rosemary Senegar and Henry Moses and Gloria Moses, and those who have come before me that I learned from them what hard work looks like and what passion looks like and what purpose looks like, and how do you combine that with the knowledge you have and the responsibility to share it forward and give it forward and make sure that you leave things better than the way you found them.
You know how many people, women and men, are going to say that it was Krishna Powell who helped me find the grit in myself, because I saw it in her, and without it, we can't succeed. The passion. I'm off my soapbox. I won't do that. Hey, Krishna, it was great having you on. Let's not let it be 5 years till the next time you're on. Krishna Powell, founder and CEO of HR for Your Small Business. This has been, by the way, thank you so much, Krishna.
Thank you so very much for having me.
I want to thank Krishna Powell, Mary, who is really a terrific leader making a difference. We'll make sure we have her on Lessons in Leadership in the future. So we have a couple of minutes left. I want to talk about this. So I don't know why I searched this the other day. Ever notice how I'm searching leadership related topics and come across an article and I share them with you? And she's like, really?
No, I'm not. I enjoy those.
On a Saturday afternoon, I'm watching a basketball game or football game and I find an article and I send it to you and I just say FYI. You think, really, seriously? Can't you
No,
just watch?
I've got nothing but time. Both my kids are in school, so it gives me some nice reading on the weekend.
But one of the areas I searched was co-leadership. Now, we do a lot of work around what's called dyad leadership, Mary, at Hackensack Meridian Health in our Physician Leadership Academy that we do there. We talk about dyad leadership, the Executive Leadership Development Program there. Dyad leadership, meaning there are two quarterbacks. And my argument has always been, Mary,
there has to be one quarterback. And you say we teach that, but we do. We make sure, even if you're a quarterback for a portion of what you're doing, but there needs to be one person, even like, it's like 51% of like 51% ownership. If it's 50-50, then there's no one that could be the one that's going to be that tiebreaker if an important decision needs to be made. So co-leadership is...
What the heck is co then? So look at...
I consider, and I'm glad we're talking about this. I consider you and I co-leaders of our organization. We both wear different hats, but we know at the end of the day, you are the one that is going to make those final decisions, right? And I'm not elevating myself to, Mary,
That's not true. That's just not true. There are a whole range of decisions where you have made the final decision, and I saw it different.
But ones that really drive this ship forward. That's why you are the chief executive officer, right? That's why you are the head honcho. There needs, and for good and for bad, right? You said it all the time. No,
hold on. That means you take responsibility. Look, we have on our production company, the Caucus Educational Corporation, we have two great co-leaders, Jackie Chicarico, Jackie Heyer. Mm-hmm. They are co. That doesn't mean there isn't a division
but they're
of labor.
both leaders of their own series. So it's so funny. My husband always says, you just got to know your role. As long as everyone knows their role, stays in their lane for the most part, and handles their strengths, handles what they're really strong at. I think the co-leadership thing is good, but there has to be someone that is always the final decision maker, in my opinion.
And therefore, if those co-leaders disagree, you're saying that's why the 51% versus 40.
Yeah,
wow.
I do.
What, a shareholder meeting?
What's that?
Is it a shareholder meeting?
It kind of is. Yeah,
really?
I think it is. Well, there has to be that safety net, because if not, you can end up having a stalemate and nothing good's going to come out of that. So,
what is Elvin saying? My role.
Elvin says, my role is to tell you to say goodbye. I love that sense of humor at the end of a long tape day.
If people could ever see what goes on in that chat room. To Elvin, to Frank, to Scarlin, to April, to Sylvester on the back end, to Mary Gamba, and our entire production team at Lessons in Leadership. Did I miss anyone?
Amy on closed captioning. Give a shout out to Amy.
Amy on closed captioning. It was terrific. Hey, listen, thank you, everyone. And this is Lessons in Leadership. We learn every time together. Mary's the leader. See you next time. This edition of Lessons in Leadership is made possible by the Buccino Leadership Institute at Seton Hall University, Prager Metis, Valley Bank, the International Union of Operating Engineers, Local 825, the North Ward Center, the New Jersey Sharing Network, Delta Dental of New Jersey, the Helix, the Fedway Associates, Inc., the Port Authority of New York and New Jersey, Veolia, Resourcing the World, Choose New Jersey, and Seton Hall University, showing the world what great minds can do since 1856.
This is Mary Gamba. If you want more leadership tips and tools, log on to stand-deliver.com. That's stand-deliver.com.
Promotional support for this edition of Lessons in Leadership with me, Steve Adubato, and my colleague Mary Gamba has been provided by NJ.com, NJBIA and New Jersey Business Magazine, CIANJ and Commerce Magazine, and the Meadowlands Chamber and Meadowlands Media.
Introducing the Helix NJ, the Health and Life Science Exchange, a new innovation district located at the heart of the Northeast Corridor, providing industries, universities, and entrepreneurs the critical ecosystem needed to turn great ideas into breakthrough realities. The Helix NJ, where ideas come to life.
Most people don't think about where their water comes from, but we do. Veolia, more than water, resourcing the world.